with Dr. Rod Oyarzen from Salem Hospital. Hi, doctor. It's so good
Hi,
to see
good morning.
you. We're learning so much more about cardiac surgery because of Dr. Oz and really kind of this entree into what cardiac surgeons actually do through television. Is that a good thing?
Yes, it is. There's a lot of new there technologies and advances that we're trying to keep up with here in Oregon.
What's the most common procedure that you perform at Salem Hospital?
Well, today coronary bypass grafting is still the main operation, and probably 80 to 85% of most of the volume of cases that we do is revascularization of the heart with coronary bypass surgery.
I've been reading about Salem Hospital's incredible ranking as a place to go have your heart fixed.
Yes.
And I'm wondering what causes that kind of ranking? How do you get there?
I think it's been a lot of effort and strategick planning from the administration and certainly the physicians themselves who have set this goal of becoming a center of excellence in the Willamette Valley, and I think we're able to provide excellent care to patients in almost any area of the medical field, from cardiac surgery certainly, and some other areas, orthopedics, and even family practice today is a booming area.
So in every other area of technology, lasers have just completely redefined how we do things. How have lasers affected your career?
Currently we have some technology that help patients who are not candidates for the traditional coronary bypass grafting and they still complain of chest pain. So we are able to drill some holes through the myocardium and provide new blood supply and relief to their symptoms.
Wow. It seems to me that given the myriad of cardiac problems people present with, that we now have a solution for almost everything.
That's remarkable. Cardiac surgery is probably the youngest field among surgical specialties. It wasn't until the mid-50s that we were able to proceed with heart operations the way we do it today. So in a matter of 50 years, from not being able to touch a heart, we're able to operate on almost every condition, from pediatric congenital malformations to the management of coronary disease and even arrhythmias.
Yeah, I read this week, in fact, that the general population that's been told to live with an arrhythmia for years, and sometimes kids find out about it when they're 12 years old and they live with this haunting thought that their heart could go off wildly at any moment. Now you're saying, no, don't live with it, have surgery.
There is a procedure that we are performing today at Salem Hospital and many hospitals across the country designed to treat common arrhythmia, which is atrial fibrillation. It's a common abnormality of the electrical component of the heart. And for many years, the only options were either medications for life or percutaneous catheter ablations. But today we have this new technology that allows us to treat this patient in a more effective way, and we have very good results so far.
So fibrillations are most often caused by congenital defects, but I'm curious what percentage of your procedures are caused because of things that people are born with versus lifestyle choices?
There are some arrhythmias that are the product of congenital defects, but the vast majority of patients who end up with atrial fibrillations, we don't have a real good explanation, but it's a very common condition that affects a lot of patients, and many of them are managed fairly well with medications. But today, with this new technology, we are able to select some patients who will benefit from surgery, from a surgical approach.
So I think one of Salem Hospital's most important pushes is to talk to people about how to keep their hearts healthy so that they don't end up on your table. What do you tell your friends at dinner parties in terms of just essential things to think about?
I think to use common sense. I think by now most people know what the right thing to do when it comes to diet, exercise, and healthy living is. I think it's a matter of choice. But I think more and more we see people who embrace this healthy lifestyle, whether it's because they are not feeling well or they want to make a dramatic change in their lifestyles, and health not only involves diet and exercise, but also mental health and good living.
Would you ever consider being Dr. Oz locally? You're very good at what you do. We've We've been talking today with Dr. Rod O'Yarzin from Salem Hospital. Salem Hospital, if you want to find out more, go to our website, keyword Salem Hospital.